So I'm Andrew Pedtke. I'm an orthopedic surgeon in the Bay Area. I'm also a co-founder of this company called Limb Innovations. We are developing prosthetic socket technology, and I'm going to touch a little bit on our device and not speak so much about the service model around what we're doing, but kind of jump forward into the future, since I have this opportunity to speak to a lot of visionary folks at Stanford and other stakeholders that might be wanting to look at more population health matters. So our vision is to enable the disabled, to help those with disability live beyond their limits of the prostheses or their devices that they're wearing. Disability is an interesting word. It's kind of like, I was talking to somebody the other day that you might have seen her on TV. She's an amputee who has designed this kind of pointed prosthetic. She's a singer, and she's like, I don't believe in the word disability. And we're talking about how in Alaska, our Eskimos have 7 different words for snow. And for us, we use this word disability to kind of explain the human experience that someone has that's living in a world that's more tuned for those that don't have particular limitations, whether it's mental health disability, whether it's physical disability. So it's kind of like not having a leg and living in a world with that's basically built by people with 2 arms and 2 legs. So the chairs look different. The steps that lead to the beach are it's hard to navigate. But we don't have a lot of words to understand that. To focus on one particular disability, we are interested in addressing amputation, and there's a lot of business reasons around that kind of out of the scope of this talk, but there's kind of 3 particular etiologies of amputation: vascular, trauma, and planned non-vascular, such as cancer, or maybe you could add congenital in there as well. That being said, having an amputation is much more than just a particular diagnosis. It's much more than how well you're walking or not walking. There's a whole journey or an experience that an amputee faces as they go on in life, kind of relating back to what is the experience of someone with a disability. So for us, our company particularly chose the prosthetic socket as the culprit that's affecting this experience, this holistic problem, much bigger than just just the diagnosis itself. If you look at the industry, everybody says, "Oh, prosthetics have come so far. There's fancy microprocessor knees, there's cheetah blades, people running fast, etc." But there's really an archaic interface solution that is holding the industry back and continues to hold the industry back. And this is what we think is kind of one of the core unmet needs. It's sort of like a wooden shoe, if you will, that the amputees put their limbs into. And we're going to kind of fast forward on the importance of that. Can I have the next slide, please? So our product solution that I'm going to talk about today, go a little bit into the dynamic socket, if you will, and the connectivity around that. We have support from the Office of Naval Research. It's kind of like DARPA. They're 2 blocks down the street from DARPA. A lot less money, a lot less visionary, but that being said, much more practical focus in their healthcare efforts. So our particular design is something that's simply scalable. It's different than a wooden shoe. It's something that has adjustability. It can be mass customized. There's user engagement. There's clinician adjustability. Something that can live and be more dynamic with the patient over time. Next slide, please. So this is in the market. It's what we're currently manufacturing here in the Bay Area and selling and whatnot. About 500 patients on our socket. Selling in about 40 different states. We have some international sales. We've been able to get it to the point where we can take 2 pictures and measurements of an amputee's limb in London, send that data to San Francisco, and FedEx a socket out in a day. Totally different than the conventional model where you have like 30 days of craft iterative fabrication. So, on the next slide, please. Our mantra is really comfort, freedom, and access to care. And so, comfort's one key metric. We're looking at that, studying that in more of a formal fashion. Next slide, please. And I think I might be back online. Nice. Secondary outcomes, looking at falls, less pain medications. But jumping forward, what is the case for data in disability? What is the case for understanding this human experience, this journey map? Well, kind of a compelling article here that says that evidence-based medicine is an insufficient tool through which to understand rehab medicine or disability. So evidence-based medicine is the tool through which we value particular technologies. It's the way we pay for things. It's kind of like saying, well, based on the data, 13-year-old through 18-year-old should get IBM computers and 70-year-olds should get Apple computers and they should cost this much. That's how we use data to define the care, the services, the technologies that people get in the healthcare system. It's different than the consumer industry. But it's not a perfect system because it doesn't, for disability, it's very difficult to define that journey map and value that based off of technologies. Next slide. So the problem ecology is much bigger than just, the device or the diagnosis. Next slide, please. So let me give you a case study on why data is important for a connected socket. So here's a patient. It hurts. I'm not wearing it. I can't wear my socket. I can't get up. I'm in a wheelchair. Next slide. Payer says, okay, show me evidence that a loose fit affects clinical outcomes. I mean, I don't really understand that. Why do we need to pay for a new device? I don't understand. We're in this modern healthcare ecosystem of cost, containment, improved health, better outcomes. Next slide. This is how much prosthetic care costs on a yearly basis for an amputee, $20,000. So how do we address this? Sockets are $10,000 of that. Next slide. Provider says, well, I know my patient needs a socket, and I know they need something new. It's not fitting well. I don't have the new design that allows for adjustability, so I got to get them something. I got to make them a whole new socket. So they say, here's documentation of X amount of volume loss and so on and so forth. This is a hard thing. This is trying to get data in real time and give it back to the payer. Next paragraph. Sorry, next slide. So what's the power of adding smart technology to prosthetic sockets? Next slide. So we did a little bit of a research study around this, kind of wondering, does socket shape affect outcomes? This is our below-knee transtibial device. Next slide. And this is our above-knee transfemoral device. So what we did was we changed our socket to negative 25 pounds of closure tension, so loose socket, a neutral fit, and then 25 pounds of closure tension, tight, like the tight variable. Next slide. Connected the socket with force distributors, basic kind of sensor makeup. And we put in place various key metrics for the disability space. So this is one of actually the harder parts, is what makes sense for the payer and what makes sense for the stakeholders. What do we look at to justify a replacement or a new technology? L test, 2-minute walk test, 4-square step test, socket comfort score. These are just some metrics that we used and decided. So some of the results, we showed that pressure versus tension, basically with changing amounts of brim tension, changing amounts of tension on our modular device, which is something different than the conventional design. You're not able to do that. Demonstrates different force readings. Clinically, which is the clinical justification of this type of data isn't really understood. So there isn't really real-time data that can look at human function as it pertains to how someone's interacting with their device. And that's meaningful, if you will. So the socket comfort score is changing. The 2-minute walks test is changing based off the particular features of our volume adjustable socket. So in summary, changes in a closure system tension had direct correlation with the relative pressure distribution. When the closure system was looser, patients experienced higher distal pressure. When the closure system was tighter, the patients had more proximal pressure. And the functional outcome scores in the socket comfort scores were lowest at the loose setting. So this type of body of evidence is not, it's something that a connected technology can help in terms of payer justification. Something that we can start to say, well, my socket's loose, and here's the data to show why, how loose it is, and so we can better get an understanding of what that, when somebody will need a new socket more reliably. Next slide. And then, of course, there's more simplistic ways to look at connected technology, more of like wellness, looking at just something that the patient themselves can engage with, they can enjoy, they can set goals. And I have some videos and design research on how some individuals have actually used Apple Watch and whatnot to set goals and help lose weight. Next slide. It can get, even more exciting when we start to think about gait. So pushing your foot on the force sensors on the ground and doing gait analysis is no different than putting a force sensor on your socket and measuring gait. And there's a whole body of evidence that's out there to look at gait, looked at not by a doctor or a researcher saying, walk straight and let's look at your gait, by looking at this in real time. And where we're going with the Department of Defense is some very visionary stuff around kind of human function. They're trying to get their amputees back on the battlefield, believe it or not. The cost of a Navy SEAL that's injured is, they put millions of dollars of intellectual capital into a Navy SEAL. If they lose their leg, they want them back on the battlefield. They want to get these guys back. They're really pushing the boundary in terms of human function and how people interact in a kind of a group setting too. So kind of just bringing it back to the patient journey, or how connectivity could start to change that and start to offer quicker access to care, quicker solutions, leveraging new design, et cetera. Next slide. So thank you. These are some of our other collaborators, contributors working with some rehabilitation hospitals, primarily located in the South, and then Hospital for Special Surgery in New York.